Thank you, Mr. Chairman. Mr. Green and Mr. Gottlieb, I have a question. I'm going to frame the question, and I'd like, Mr. Green, if you'd start, and then Mr. Gottlieb, you would weigh in on this as well. One, I want to thank the chairman for holding this in this series of hearings that we're going to be having on looking at these issues and on similar topics, but I also want to focus a little bit today on one because I want to encourage one that would be a hearing on this issue in particular, but it's the effects of PBMs on competition in the healthcare market and how Obamacare may have affected that competition in that area. This summer, the FTC approved CVS's acquisition of Omnicare without conducting a significant investigation into the combination of the largest long-term care pharmacy with the largest Part D PBM. The FTC's lack of action ties into other concerns I've heard from my constituents about the conduct of PBMs and their effect on competition. Independent community pharmacists play a vital role in Northeast Georgia, where I'm from, a rural community, and across the nation, but they're being crippled many times by burdensome regulations and also the often, at times, abusive PBM practices. My constituents and I share a concern that the way Obamacare treats the PBMs will further harm independent community pharmacists. To that end, Mr. Green and Mr. Gottlieb, I'd like to know, in your opinion, what can be done to ensure independent pharmacies and PBMs can compete on a level playing field, and this post-Obamacare environment, has really Obamacare affected that? And do you feel like, aside from congressional action in the PBM space, could the FTC be doing more and, in this area of PBMs and independent pharmacies, especially in the healthcare chain, as we'll discuss it? So, Mr. Green, I'll start with you.
Well, surely I agree, Mr. Congressman, that the PBMs are like other intermediaries in healthcare. They play an important role in containing costs and doing the bargaining. But if their size and their market structure is concentrated, we face the same problems we face in other industries. And I think particularly in PBMs, there was the controversial decision of the FTC to allow the Express Script Medco merger some years ago.
Excuse me, sir, can you pull the mic up?
There was some question about the FTC's decision to let that merger go forward. And at the time, the FTC was comforted by the fact that there would be new entry and smaller participants would generate more competition. And the FTC has done retrospectives of its own decisions, and this might be a good time for it to do so, to look back and say, how has that worked out? And to the extent that their prior prediction has proven untrue, and I don't know that it has, but I've heard talk that it has, maybe it would be time for a retrospective to see how the market is operating.
Okay. Mr. Gottlieb. Dr. Gottlieb.
Well, I'm less concerned, to be honest, about the vertical integration of PBMs trying to make acquisitions outside their core space and the horizontal acquisitions that would increase their market concentration. The reality is we have a concentrated market for PBMs, and the Express Medco merger would concern me more than the Omnicare acquisition, because it's more of a vertical integration. What's happening is the PBMs are trying to sort of buy their way out of their current market to try to capture more margin from other market segments. I think that this would all be less concerning if it was easier for new PBMs to get started and existing PBMs that are small to continue to grow by trying to offer focused services and differentiate themselves in the marketplace. Quite frankly, I think the health plan consolidation will make it harder for smaller PBMs to continue to grow, and will potentially give more market share to some of the existing large PBMs.
Well, I think one of the things right there that concerns me is look, there is a PBM market there, and we're understanding that, but my problem is concerning our independent pharmacies and others who are outside this, who provide a service in communities in the healthcare chain that are basically, because of many times the practices, small or large, are being wiped out. I wasn't going to do this, but Dr. Mack, y'all have anything to add on that, especially because I've heard from physicians as well who struggle with their patients to get drugs filled at a certain area, and because of restrictions, especially in my area of a rural area.
I would agree with you as another person from a rural area, sir. What we have found in practice is that the PBMs add another barrier because of their large consolidated structure that makes it hard for us to get patients what we want, and it has driven a lot of independent pharmacies out of business. And those were the pharmacies where when somebody needs something at midnight, you can get the pharmacist to provide the drug. When it's a large consolidated company living 1,000 miles away, they're not going to open a store to get patients something in the middle of the night.
I'm glad I'm not one of the only ones that's actually been ringing this bell. Look, this panel is great, and our time is limited. I think Ms. Durham, I think we've had a chance to talk about this, you know, how we deal with this and isolate. I appreciate you being here and the challenges of rural health care in a market in which consolidation is really not an aspect because you have a dominant player and you have a lot of smaller players due to many things. Obamacare, frankly, is one of them that is very struggling right now in many markets. So, again, Chairman, great hearing. I think this is something we need to continue. Again, my folks a little bit more on that issue of drug in the whole healthcare chain along with our hospitals because it's been affected in them as well. With that, I yield back.
Thank you.